So whilst you're waiting, as this is all about meditation, I thought it might be nice if you have a couple of breaths and just relax and chill out.
So good evening, everyone. And I just want to say a big welcome to it's the fourth in this series, isn't it? Meditation Techniques for Exercise. It's lovely to have you all here. I'm Liana Luxton. I'm a physiotherapist and co-founder of the Remote Rehab platform. And this is our commitment, which is to deliver free webinars every Monday for the foreseeable future. And our goal is really to deliver online learning and topics that are going to make you think and explore different topics than you normally would. So I'm really excited. So far, we've delivered about 11 webinars, including tonight. And we're really, really pleased. And I'm going to let you know the next 4 webinars at the end of this one. So yes, I hope you enjoy it, and I'll pass you over to Sharon.
Yes, hello, I'm Sharon Milroy. I'm one of the hosts, and I work as a mindset coach with really bringing the psychology to what we're doing here on Remote Rehab. So yes, I'm looking forward to joining in with you today and being thoroughly relaxed by the end of the session. I'll also be keeping a note out, like Caro's just said. You'll find at the bottom of your screen the chat, so any comments that you want to make between each other, anything that you want to put in there, and then separately there's the Q&A for any questions that you have. And if you pop those in there, I'll be keeping an eye on that, and that's probably towards the end we'll get an opportunity to discuss those questions. So please feel free to put them in there. And I've just put in, and I'll do it again later on, I've just put in the contact details, links for the newsletter, the events page, and for the community as well. So if you haven't joined up and seen those before, please make a note of them. Caro.
Thank you, Sharon. So first of all, I'm just going to unpin you both.
That sounds painful.
Yes, I'm removing your spotlight. There we go. So hello everybody. So I am Caroline de Riviere. Most people call me Caro. And I work with many people who want to change their lives. By really releasing their inner restrictive patterns. People who may have gone through some sort of trauma, I like to say a life-changing moment. And I suppose I help to bring them the spirituality into their new situation through meditation and through coaching. I also use visualization practices and really help them to open to the awareness to the possibilities of their new life. I'm a natural intuitive and a vibrational healer, and previously worked with non-verbal communication, horses and learning difficulties. And so years ago, equine facilitated therapy, and I've been practicing meditation for about 25 years now. And of course, my meditation teacher, I remember him, I always remember the words he said, of course, the whole of life is a meditation. It's not a thing that you actually turn off and turn on. So I didn't quite understand him all those years ago, but I'm beginning to now. So yes, so for the past 4 weeks, we've been focusing on webinars around awareness, our learning styles, visualization, and tonight we're going to be looking at meditation techniques for exercise. So I'm going to share my screen in a moment with you, just making sure I don't forget anything here. But just to start with, I thought it might be interesting just to see where the audience is. Can you share with me if you practice meditation yourself, or if you've used meditation in movement at all? Just share in chat, just put a yes up if you do meditate, or you have meditated or had any experience at all. Just put yes in the chat. Yep. Hi. Yes, we've got some. Yes, 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 I meditate. Ah, lovely, wonderful. So I'm preaching to the converted, obviously. So without any further ado, I'm going to... Oh, it's static dance. Yes, we've got some things. Yes. Have you tried the 5 rhythms? That's really interesting to do. Okay, so I'm going to share my screen with you. And I've got a few slides, but we're actually going to do a lovely demonstration a little bit later when we've got through the slides. So I'm just going to open that up. Okay. I think we haven't started at the first slide, which is what I normally do. So meditation, yeah, proved to be relaxing and restful. And why? We're stopping, basically, aren't we? We're taking a pause, we're taking a moment, putting our everyday life on hold, and we're just taking that time out to just chill out and relax and become restful. And more than that, with meditation, we're actually creating a practice which perhaps we've been taught, or we've managed to do something by reading about it and we've taught ourselves. And we're just moving from thinking to being. And this is beautiful that we're actually getting interrupted, because that's life. That can be what happens. And it just reminds me of my lovely meditation teacher again, who, when I complained that when I first started meditating that people were being noisy in the house, he told me about the time they meditated for peace, and they were about a mile down the road from bombs dropping, and they were all doing advanced meditation techniques for peace. And at that moment I zipped my mouth, and I never once again complained in the last 25 years about any noise going when we're doing meditation. So yes, this is what happens in life. This is real life, isn't it? We get interruptions, we get things happening, and we can still just notice those things, and we can, if you like, rise above them. We can notice them, but we don't have to embellish them with more thoughts and creativity. We can just allow them to go. And so we're creating this space of calm, and we're just calming the mind and allowing whatever wants to come into the awareness, and we're letting it drift off. So we're lowering stress, and we're relaxing the nervous system. So when we're stressed and tense and anxious, our blood's lactate level increases, which can lead to a whole array of problems. And all of these levels are greatly reduced during meditation, much more quickly and effectively than drugs or other methods. And I can remember my mother, who suffered from very high blood pressure and was on all sorts of medication. She had very bad rheumatoid arthritis. And the doctor could not bring her blood pressure down. And she learnt transcendental meditation. And after a couple of months, she went to the doctors, and he said, "What have you done? Because there is no way that your blood pressure could be this good." And she virtually got back to a normal blood pressure. And that was through meditation, but drugs couldn't touch it. So, types of meditation. I just mentioned transcendental meditation, which happens to be the meditation that I learned also after my mother's amazing results. Mindfulness, this is where we're paying attention, and we're going to be using that in a moment in the demonstration with the movement. We have spiritual meditation, focus meditation, transcendental meditation, and movement meditation, which we're going to concentrate on tonight. So I'm just going to skip through that. So what is mindful meditation? So mindfulness is very popular now. There's a lot of talk about it. 25 years ago wasn't the case when I learned. It was something that was just, felt like it was just beginning. Maybe it wasn't, but to me it felt like it was just beginning. And I was doing a lot of meditation with horses and movement meditation in nature and paying attention. And I love doing that. And I love, moving with awareness. So mindfulness is paying attention to the feelings. And with this picture, you see this lady here, she's closed her eyes. It's really nice to be able to close your eyes and come inwards. You're circling back inwards, inside. So you're noticing your feelings, you're noticing the thoughts, you're letting go, you're becoming present in the moment. And at the same time, you're using awareness to the breath and noticing the rhythm. And there's something around the inward and the outward breath. It's like the inward and outward flow of the sea. I'm sure you sat on the seashore at some time, maybe more often, or maybe at least once in your life, where you've noticed that rhythm of the sea going out and the sea coming in. And I like to sort of think of that in the breath and the rhythm. And actually, when you start to expand and you think about the rhythm and the rhythms in nature, and you start to come into alignment. And then, as I said, you just start to pay attention to your own rhythms, your own thoughts. But we just notice, and this is the power of the meditation, is we notice with awareness and expanding our awareness, but we don't actually react. So hopefully now everybody's beginning to relax a little bit. So let's take mindfulness meditation to the next level, into the movement. So in this picture, the lady's got her eyes closed, and of course there are times where you need your eyes open. So you don't need to have your eyes closed. But of course, if you want to kind of circle back into the body, it may be that you briefly close them when you're moving and you're open. So maybe you're closing and you're opening. Movement's really good for people who are anxious. It allows them to be doing something rather than sitting. Some people who are quite anxious find it difficult to meditate, and it can actually kind of activate the anxiousness before that, eventually passes on. The movement can help process the physical trauma, and the movement can be as slow as it needs to be, so that you're matching the movement, if you like, with the awareness, with the breath, with you understanding your body a little bit more. It has the potential to unstick the freeze response. So if people are in trauma and it's created a stiffness or a contraction response, this can help to unlock this. And movement can promote a calmer response. It's also integrating the mind and body and resetting the nervous system. So insights. So when we're creating movement and awareness and we're paying attention, we can gain insights to our own beingness. We can gain insights to our own learning, our development of our physical structure, what's happening for us. The other thing it can do is to activate patterns. So to give you an example of that, I went to the Isle of Wight the other weekend, and I was walking up. I decided I was going to have a long walk, and I twisted my ankle some weeks ago, and it's not 100%. And it's a long walk. Where I chose to go was a really steep hill, and it was a long, about a mile walk, and it was constantly up. And it was somewhere that I'd used to ride when I was young. About 6 years old, I used to ride up there on a pony. And when I got to the bottom of this hill, I was so excited about walking up, because it felt really, I'd never walked up there before. I'd ridden thousands of times. But as I started to walk, what it brought up for me was feelings of not not necessarily feelings that went back into my childhood, but it brought up feelings of, am I going to make it? This is really difficult. You know, how you get excited about doing something, and when physically you go to do something, it can push a lot of buttons for you, because it can bring up things that physically you feel that are difficult to do, but you realize that those things actually play out in other areas of your life. So movement meditation can do this. It can activate emotions. And so it's, you know, don't be surprised if somebody's moving and they're bursting into tears, and that some long held memory or some difficulty just comes up and presents itself. And a lot of therapists worry about, well, what do I do if somebody's doing this and I'm with them and they start to cry? You know, we had a question the other week, what do I do if my patient cries? And I will say, just be there, do nothing. And imagine the role is reversed. Imagine that you're releasing trauma. And in that time, what would you like somebody to do for you? You probably really want to be involved in your own release. If you're fully engaged with the process of healing, you may really want to pay attention. The last thing you want is somebody interrupting and changing the energy. It's like you want to fully get as much juice out of this experience as possible. That may not be true as well. It may be that somebody wants you to place a hand on them, give them reassurance, say, I'm listening, or it feels like you're going through a really difficult time. Do you want to speak about that? And all of that is appropriate. But I say, you know, just be careful that you don't interrupt their process. And it's okay to say, do you need me to do anything for you right now in this moment? Or do you want to keep experiencing it and just me be here and hold this space for you? So, okay, let's look at some movement meditations. So we've got the simple ones, and of course everything that's good is always simple. So walking, easy, anxiety reducing movement-based techniques. So let's think about walking and mindfulness, and let's think about breaking that down, because you're not just going out for a walk and you're looking here and you're looking there and you're all over the place and you're saying, oh, it's a beautiful tree over there and a beautiful this. That is a type of mindfulness, but for this purpose, we're looking at our physical being. So in walking, and with any of the exercise, say slow down as much as possible. Think about, start to bring the awareness. So start off with standing and breathing and feeling into the body, bringing an awareness of the outside and the inside. Breathing, relaxing, connecting, being aware, and find somewhere obviously that's safe for walking and reduces anxiety, maybe a park or a field or somewhere that's familiar to you and somewhere that is lovely to be. And bringing that awareness in and then slowing down the steps so that you're really feeling the movement, really feeling the heel going down on the floor, the foot coming down, making contact with the ground. And you're noticing what you notice. Gardening can be another one. So gardening's beautiful because you're connecting to nature. That's, of course, if you love nature. Some people don't. So you're engaging with more of the senses, perhaps, with the gardening. Maybe you've got plants that you're tending to have a beautiful aroma to them. So you're engaging the smelling. And again, slowing down, spending time to gaze at the flower or whatever it is that you're doing. But let's just use the flower as an example. So you're gazing at the flower. You're looking at it and you're engaged with it in a way that you're wondering, what is this? You know, what is this thing in front of you? Because we have all sorts of preconceptions about what it is, but what is this flower? and what is my relationship to it. So gardening's beautiful if you're looking at your relationship with nature, relationship with something that's outside of you. When it comes back into the body, you may have somebody who's literally gardening because they have all sorts of mobility issues and they didn't before their trauma. They're loving their garden, and you can obviously use the garden to be able to bring that forwards into awareness, and using that as a goal, and using that as to move the hand or the foot, whatever it is, digging the garden, and breaking it down and doing it really slowly and noticing the movements and how you're feeling in those movements and bringing awareness. Swimming, yeah, swimming's lovely. So if you like swimming. So swimming, either in the sea or a swimming pool, breaststroke, it's got that beautiful rhythm where you can use the breaststroke as the in and out breath, and you can get into quite a rhythm, and that can have quite a profound effect to the exercise. And of course, again, if you've got mobility exercise difficulties, you know, some sort of support for the swimming, you'd have to think about that. Body awareness, I suppose most people when they think of meditations are thinking about yoga and Tai Chi, and those that you can, sorry, I just got a wasp flying in front of me. So yoga and Tai Chi, and those are sort of pretty regular movement meditations. They're beautiful, and especially lots of slightly older people would really enjoy Tai Chi, and I know it's very popular at the moment. And a simple body movement, just using part of the body that has reduced mobility, and we're going to do a little practice in a moment to show that. Okay. So 5 components to a movement meditation. Just ones for you to think about for a moment. So we're using breath, we're using focus, we're using movement, awareness, and space. And I won't talk about those too much because we're just going to come into those now into the demonstration. So everybody, I'm hoping that that you're all going to join in. That would be lovely. So if you want to join in, wonderful, because we will ask questions afterwards just to check if you joined. Okay.
Well, it's also to have an experience, isn't it? So
yes, it is. I'm only teasing.
Yeah.
I'm teasing. Okay. Okay. So yeah, Sharon's been very good there, correcting me. Not allowed to joke. Don't joke, Sharon.
No, I don't mind you joking. It's just that so that you've got your own reference experience before you're asking.
It is. So, so this is about you just, you know, having the being able to embody the practice a little bit. So if we start off by just sitting comfortably and breathing, always good to breathe, and letting go of any tension. And I'd ask people that if they've got a patient at the moment who has some type of upper limb difficulty, then just imagine them when you're doing this, and imagine how you might adapt it to them. And what we're going to do to start with is go through the exercises as though you're okay and have mobility, and then we'll have a little chat afterwards about adaptions, and you may like to think about that as you're going along. So first of all, just thinking and feeling, I should say, about what's happening now. We're going to I'll just push this back a little bit so that you can see. So just notice what you notice about the sensations in your body. Make yourself comfortable and just allow the space without forming any judgments about the feelings or thoughts that are going on for you right now. And then the first move that we're going to do is we're going to just put our hands out in front of us. So maybe you'd like to rest your elbows on the chair or on the table or on your lap. You can have the hands together or apart. You can have one hand or both hands. And you can have eyes open at the moment because you're probably wanting to watch, but also you can sort of close the eyes as well when you're doing the movement and just listen. So just paying attention to the breath, the inward and the outward breath, and we're going to synchronize the movements of the hands with the inward and the outward breath. So first of all, on the outward breath, we're going to open the fingers and stretching outwards. And on the inward breath, we're going to close the fingers, not the wrists, just the fingers, close up and just tense them. And then on the outward breath, we're going to stretch them. So if you could continue just inward breath, close the fingers. Slow everything right down with the breath, outward, just stretching. And whilst you're doing this, just take a moment to notice where you feel the muscles stretching, where you may feel some resistance or tightness, and where you feel spaciousness. You notice what you're feeling, what you're thinking, but at the same time coming back to the breath. Closing and opening. And breathing. And now just rest the hands down where they're comfortable. Either put them on your lap or on a table or somewhere that's comfortable. And just notice the stillness. Just notice any sensations that have arisen through moving the hands. And just notice the experience of both the benefits and the challenges of the physical stillness. So now we're going to bring the hands back up again. And we're going to do the same movement as we did before by closing the fingers, but this time we're going to engage the wrist. So on the inward breath, we're closing, 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 and flexing the wrists back towards your shoulders. Outward breath, opening, stretching, stretching, stretching. Inward breath, closing. And as you're doing this, keep going, just doing this. And as you're doing this, you're just noticing the warmth or the coolness within your joints, the firmness or the softness of the muscles. Noticing the breath, and you're just expanding your awareness to take in the room that you're in. So you're watching all this going on, you're feeling this all going on. You're expanding your awareness into the room that you're in, and then you're aware of your surroundings, but then you're bringing that attention back into the hands, into the movement, into the wrists, into the breath. It's slow and gentle and gradual. You're noticing your hands, probably for the first time in ages, these amazing, amazing hands. And you might even want to now just stop, turn your hands over, look at the back of your hands, and just be in absolute awe and wonderment about these amazing, amazing hands that we have. and bring them into stillness again. And just noticing what you notice. Okay, so we're now going to bring in the elbow joint. So bring the hands back, or the hand back in front of you. Open or close the eyes. And now we're going to close the fingers up, roll the wrists back, and tense the elbows. So we're bringing our fists, if you like, back as far as we can to our shoulders, wherever's comfortable, but adding a little bit of stretch as well. Noticing what we notice. Notice the breath again, and on the outward breath, opening everything out, opening the fingers and stretching forwards a little bit, stretching the elbows, breathing back in, and slow it down so that as we stretch forwards, we're stretching the fingers out last. When we're coming back, we're closing the fingers, rolling the wrists, rolling the elbows back and out again, forwards, and stretching the fingers out. Just breathing, and just do it a couple more times. And then resting pose again. Now this time we're going to, while we're just resting, this time we're going to actually engage the shoulders. So this time, this is the last movement. And whilst you're doing this movement, ask yourself the questions about what benefit does this offer? What happens as you move in your breath pattern? How you're feeling mentally and physically? If it brings up any emotion in you, do you feel calm or energized? And what we're going to do is we're going to start with the hands. We're going to just move back a little bit so you can see. We're going to roll up, close, 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 roll to the shoulders, and then we're going to roll the shoulders backwards, however feels comfortable for you to do. Outward breath, opening it all out again, stretching and softening. Feeling the movement coming back again, breathing in, coming back to the shoulders, rolling the shoulders. Outward breath again, stretching forwards, stretching the limbs, and just pull the shoulders forwards a bit. Stretch out to your computer screens if you can. Just stretch out, yeah. Stretch out so you really feel that stretch across the back of the shoulders, and then a couple more times on your own, folding everything up, rolling the shoulders, really feeling it, noticing what you notice, breathing out and stretching out, stretch right out as far as you can go. Beautiful. And just spend a moment now just noticing what you're noticing. And come to resting pose and feel the energy, the lack of energy, the energy, how that's affected your body. And very simple, we're sitting, we're not exerting too much. But of course, for some people, that's going to be quite difficult. And what we want to speak about now is some adaptations. But before we do that, I think maybe if we just have a little sharing. So perhaps you'd like to share and chat about how you feel. For those who've perhaps followed along, do you want to share about anything that you've noticed, how you're feeling, any awarenesses that came to you? And I'm very aware that when you're learning something, it's, you're learning something so the quieter mind's not interacting as it would if you're doing it on your own at home. So yes, if you wish to share. And Liana, do you want to share how you feel? And Sharon, do you want to share how you feel?
Yeah.
Yeah, I know that I find it difficult to stay awake during my meditation, so that I get a bit relaxed. But I think when we're talking about bringing this into our therapeutic practice, I don't know how many of us really, we observe our patients doing their movements in an assessment and say, what we hypothesize is the problem or the issue or the deficit. And if there is feedback, is almost to justify our findings or collaborate or consolidate our thinking. But it's actually what I found with the meditation, it's actually really witnessing and acknowledging and taking on board what the individual is actually feeling. So even if they're saying they feel something and on your assessment you're thinking actually you can't feel that, it's actually taking that on board. What are you feeling, what was working for you, how did that feel for you, bringing some awareness back and ownership of the patient's own body. And even for me now doing that, I realized that when I was opening and closing my fingers, my left hand wasn't moving as quickly as the right. So I'm like, what's wrong with my left hand? Why can't I coordinate them? And that's, a minor thing that you would never think about unless you're really focused on your own body.
Yeah.
So I think
how often do we actually sort of go, oh, that's my hand? Because we take so much for granted when we're well and healthy. We just take there's a sweeping statement. I take my body sometimes for granted unless it goes wrong. And then I go, oh, I better pay attention. Sharon, what did you feel?
I noticed certainly down into my wrists and through my arms into my shoulders, more tension than I realised, or maybe it was aching after all the sloe berries that I picked yesterday, getting up and stretching into the trees, and just this feeling of sort of groundedness. And it was slightly bizarre, seeing myself reflecting back at myself while I'm doing that, because there's this sort of just to go inside yourself. So yes, slightly strange, but very relaxing after my son being very persistently ringing me. And I've learnt something new, and I apologise to everybody. Don't just turn your phone off. Check FaceTime is off on your computer as well. So thank you for grounding me again after that.
That's okay. And I think that sort of thing is perfect when you're talking about meditation, because that's live.
Yes, we didn't set it up, but we might have done. A good opportunity to utilise something.
So May was saying that she felt that her right was tenser than her left.
Yeah.
Thank you. And yes, because we are right-handed or left-handed, aren't we? And very often, whatever we do, we have a preference, don't we? So it is important, even if we're perfectly able-bodied, to actually ring the changes.
And I think there's two things,
create the new neural pathways
for therapists to think about in terms of adaptation. So thinking, hand over hand, if one of the limbs isn't moving as much as the other, and incorporate and stretch into the breath. And I know sometimes we can be focused on completing the exercises as part of our self-practice for our patients, but actually these are simple things that they can do themselves, which are just moving through your available range of movement with the breath and awareness, focus and relaxation, that can be done whenever they have time. And it's a really simple thing to leave people with, to bring attention to their limb as well.
Yeah, I think there's something very special about spending, just it didn't take very long, it's spending some time with the patient so that they've practiced, and maybe, any help that a supporter or the therapist might be able to give them at the time.
Yeah, and somebody was saying about need to be careful with wrist and thumb subluxation, potentially. Absolutely agree. And what we were doing tonight is a little demo of something that you could do, but this is about giving you ideas, and it's about adapting, because everybody's unique, aren't they? So you know, it's about actually being present with your patient and feeling into what's right for them. So this is more about just getting an idea, and obviously you need to be really mindful of your patient and how any exercise is going to benefit or detract from their progress, aren't you? Mm.
And I definitely agree with that. And I think as we move forward, you know, this is a taster session of meditations with movement, but as we move forward and think about deep diving into specific cases and examples, then you'll be able to get more info and adaptations as we move forward with the topic.
Liana, are there any adaptations that you'd recommend at this point, or, you know, sort of suggestions as people sort of feel into that?
I think, first of all, we have to acknowledge that as therapists, we're not there all the time. So we have to empower people to, like May was saying, to take care of their arm. And actually this type of thing can make people become more aware of certain potentials for pain or injury. So if, you know, if you're saying, okay, we're going to be working on the shoulder, how does that feel when you're just resting there? Does it feel painful? Okay, when you take a breath in, how does that feel? How does that feel when you take a breath out? So rather than, which is what we normally do, jump into the functional assessment before we've even asked them what their baseline levels are. And I think it's also about positioning. So this type of meditation, you would hope you'd be sat upright or sat up or comfortable in a bed and supported. And you can't, you know, we're talking about the upper limb, but you can do these type of things for the lower limb, back, etc. Is having the arm supported on a pillow. And also incorporating this type of thing into mental imagery as well, and the visualization. So the movement, if it's really difficult, doesn't have to be the be all and end all. Because we know the evidence for mental imagery and visualization and in general.
Yeah.
So those would be my first tips. And I think as well for sorry, I'm getting, because I'm so visual, the chat's going, I'm like, okay.
So Liana, I know you, before we do Q&A, because I'm aware that time is going on, we've got 11 minutes left. So I'm going to just hand you back to Liana for a moment to speak about next month's webinar series, which you promised to do.
Yes, okay. So I'm really excited. We've been looking at our webinar series, and as a platform and as a community, we're really committed to trying to deliver as much free and available content as we can. So we're delighted to welcome Rachel Smith and Jane Duffy. They're the creators and developers and IP holders of the Calderdale framework, which I think people would have heard of. And they're going to be joining us for a series of webinars titled Retaining and Gaining Balance and Function. I know that in terms of remote rehabilitation, balance has been an area where can I say it? I am one. Physiotherapists seem to be tentative or a bit cautious. So we decided to focus on that. And Rachel and Jane are both physiotherapists, and together they have over 50 years experience of working with patients and therapy teams. And they're currently developing a new balance aid called Balance Active. And in the series, we'll be exploring how to support patients to retain and gain balance and function. So they'll be looking and giving us lots of information about the theory behind it. They'll be talking about how their product, but also about how we can facilitate balance re-education at these times and remotely. So you can book onto all of the 3 webinars as you have done for this one. and Sharon has put the link in the chat, so www.rrcevents.online. And even better, you can come and join us at our community and the remote rehab community. You can find that at www.rrc.life, and you get 1 month's free trial, and you can work with the therapists in our community to deep dive into these topics even more. So Sharon has put all of the links.
Yeah, they're all there.
Thank you, Sharon.
You're welcome. Thank you.
Okay, so shall we get some questions?
Yes, any questions?
Yeah, I'll put your thinking caps on. I know we've covered a couple of things, but
I think for me, so a question that I have is, do you feel that this type of meditation could be for all patients or all, I know we focus on stroke and neuro, so all conditions, and also for all patients, so going from mild, moderate to severe stroke and all those. That's quite a big question, I know.
I think science has proven, I mean, with transcendental meditation, for instance, you know, there's over 2,000 scientific studies done on that. You know, that it benefits just about everything, from high blood pressure to mobility, just all anything, because basically what you're doing is you're deep resting the nervous system. And it's different from sleep though. So, you know, with sleep, we need our sleep. So if you're a yogi and a meditator in a cave, which 99.5% of us aren't, you wouldn't need sleep. You just meditate forever. But us mere mortals, you know, we need our sleep. But when you meditate, there's a different type of rest. And so science has proven, you know, you're resting the nervous system. And because the body will always naturally come back to healing, you know, like we cut ourselves and it mends, doesn't it? We don't think about how that happens. It just happens. The body's always seeking, you know, to heal. And when you relax the nervous system through meditation, the body will, especially if you're doing something like a mantra meditation, where you're occupying the mind with a mantra which has no meaning. So it's a sound that has no meaning. So with that, for instance, it allows the body to really heal. So yeah, I'm a meditator. You know, I believe that everybody should meditate. So we've got a question from May.
Yeah. So how would you adapt this for a patient who becomes extremely anxious when asked to move her body, hyperextending, stiff as a board?
Then breathe. So I think, you know, we've done this demonstration tonight simply because we are able to move. When you come to a point where somebody really, really is at minus points to moving at all, and for whatever reason, you know, it's just to match their breathing. So in that circumstance, what I would do is, if I was sitting with a person, as I would start to breathe with them, and I would make sure that my breath was matching their rate of breathing.
Yeah.
And there's a magical thing that happens when you match somebody. And as you start to do that, and you start to deeply relax yourself, and this is the important thing, what your patient can't do, you make sure that you do yourself. So it's about coming back in, the breath work, deep relaxation, focused awareness on the patient as you're doing it. And then from that moment, when they will, in some awareness, they will feel it, maybe not in the conscious mind, but there will be a sort of matching and a sort of a joining. Then that's enough. Because actually what we got to do is to create spaces that we can just meet each other. Okay, I'm back.
Okay.
Sorry about that. I lost my Wi-Fi. I've just come back.
Brilliant. You've got another question here. It's being put in chat. It says, I have a lady with an ataxic gait stroke, can you suggest any ways I can use this technique with someone like this? So what would you say, Liana?
Yes, what would you say, Liana, to that?
I think the underlying principles are the same, you know, using the breath for movement. And I would probably start off in sitting, doing these. It depends with the lower limb, so similar thing, trying to work with the breath in and out, becoming aware. And then doing this type of thing with in a closed chain movement, so like a sit to stand. And I don't know, really trying to couple that with the deep breath in and out. So yeah, I think the technique can be adapted to that that type of patient quite easily.
Yeah, fabulous.
Brilliant. And it really depends what the outcome of that is that you want. Are you hoping for reduced ataxia, more controlled movement, or more awareness of their deficit, or awareness of their positioning of the foot, and that can then lead to where you do the meditation and how.
Yeah. And certainly I've seen where working with clients and patients where we've got into a rhythm of starting the session with this as almost a way of sort of coming together. And it's almost like an investment where the rest of the session seems to potentially be better because we've done that.
Yeah, definitely.
Yes. I love to start all sessions with just a moment of stillness and just breathing together. And then everything sort of swings from that.
Yeah.
And I think that when people are wanting to speak about their problems and difficulties, very often they'll think that they're going to talk about something, but when you've taken that moment to relax and just breathe, something more prominent comes up for them, and that's actually more or less the top level of what they need to speak about.
Yeah, I agree.
Yes.
Well,
So
I think we're about time, aren't we?
we are. We've just got, May-Lynn was just saying a further question there about adapting cues. Did you answer that, Liana, just now?
No.
Okay, sorry, I can't see it very well.
So what about adapting cues using...
Yes, basically is the answer to that. And that does incorporate the visualization I was talking about before and incorporating them together. So yes, definitely you can do that. And things under the foot, so rolling the ball, squeezing paper, reaching targets. But that, again, I think when we think about the whole webinar series, so awareness, learning styles, meditation, all together, they are a practice together because they link together and they work together. Right.
Well, I think we're done.
Thank you, Caro. Thanks for guiding us through.
We've run out of time, everybody. Thank you so much for joining us, and thank you, Liana and Sharon. As always, it's been a great pleasure and really enjoyable. Thank you so much, everybody, for joining us tonight, and I hope that you got something from it and at least can go away thinking and feeling and being aware. And have a lovely week, everybody.
Thank
Good
you.
night.
Thanks very much.